It finally happened. You get an order to evaluate and treat a patient with a disorder of consciousness. Panic sets in. You've never worked with this type of patient and you have no idea where to start. You're not even sure if these patients are appropriate for therapy. If you've had limited to no experience working with a patient like this, it can feel deeply overwhelming. The good news is with the right information, you can do a world of good for this patient population. Let's dive in. I'm Teresa Richard. I've been a medical speech pathologist for 15 years. I'm a board-certified specialist in swallowing and swallowing disorders. I'm the founder and CEO of the MedSLP Collective and MedSLP Education. Number 1, understand the continuum of disorders. The most important place to start with this patient population is to understand that disorders of consciousness, DOC, exist on a spectrum. While there are 3 defined states of disorders of consciousness, a patient can be transitioning between these phases. Those phases are coma, where there is the complete absence of arousal and awareness, unresponsive wakefulness syndrome, formerly known as the vegetative state, which is defined as arousal without awareness, and the minimally conscious state, where there is minimal, reproducible awareness that is inconsistent. There are multiple substrates for these classifications, but the main takeaway here is that a patient with a disorder of consciousness will fall somewhere along this continuum and will fluctuate between them based on their recovery trajectory. When your patient or client arrives, it is critical to have as much of the patient's medical history available as possible. This may require some medical record requests. Additionally, a caregiver interview will be important to help you identify baseline behaviors. Patient behaviors give us important information about the patient's level of consciousness. For example, a repetitive arm movement with no intention or purpose implies a different level of awareness compared to a patient who appropriately brings a cup to their lips as if to drink. A patient with consistent functional object use, like bringing a cup to their lips, may be demonstrating minimal consciousness or even emergence from their DOC. You may be asked to see a patient and think to yourself, what in the heck am I going to do with this patient? Talk to your director or medical team and see if they have certain parameters or benchmarks that warrant a screen or an assessment. I worked at one place that would only allow for us to consult on a specific level based on the scale the medical director used. Another facility allowed us to use our own scales and make our own clinical judgment, but warranted a discussion with the medical director about our findings before proceeding with formal assessment and treatment. Okay, so you know where your patient falls on the continuum of DOC. Where do you go from there? There are many tools to aid in the assessment of a patient's communication abilities. The criteria for emergence from a DOC requires consistent demonstration of a purposeful interaction with the environment. This looks like reliable, consistent communication, functional object use, and command following. How do we measure this? There are many tools available to help with accurate diagnostic treatment of DOC. Some of these measures, which can be completed by SLPs, include the Glasgow Coma Scale, the Coma Recovery Scale Revised, the Rancho Los Amigos Levels of Cognitive Functioning Scale, the Wessex Head Injury Matrix, or a clinical swallow evaluation, an MBS, or a FEES. The Coma Recovery Scale is currently considered the gold standard objective for disorders of consciousness. See if any of these specific assessments are loaded in your EMR, or if the medical team would like to specifically use any of these if they aren't currently being used in protocol. Collaboration with interdisciplinary team members is key. Individuals with DOC require a multidisciplinary approach. Collaboration between neurologists, physiatrists, speech, physical, and occupational therapy, nutrition and dietary, neuropsychologists, neurooptometrists, pulmonology, pharmacy, the list goes on. Sometimes the SLP's biggest role for patients with DOC, particularly in the post-acute phase, is one of the advocate. We can help our patients by advocating for specific disciplines to help bridge the gap for unmet needs. For example, if you're trying to use AAC or visual stimulation to identify possible emergence from DOC, it's important that a neurooptometrist evaluates the patient. Oftentimes, families aren't even aware that professionals like that exist. We can help identify underserved areas in the patient's comprehensive care plan. SLPs have unique expertise and insight which can have a significant impact in a patient's plan of care, access to resources, and their discharge disposition. Misdiagnosis among patients in an unresponsive wakefulness state is around 40%, We can't overstate the importance of an interdisciplinary approach. Imagine this scenario. A patient is demonstrating some inconsistent signs of possible emergence from a state of unresponsive wakefulness to a minimally conscious state. However, the patient has terrible spasticity from the anoxia which occurred with the brain injury. Pointing to responses for AAC is next to impossible. Visual tracking is a challenge due to the severe ocular motor impairments also sustained during the accident. A neurooptometrist is consulted and completes a comprehensive evaluation of the patient's vision and ocular motor function. She identifies that the patient has multiple visual field cuts resulting from the brain injury and could benefit from occlusion of one eye and a prism lens on the other. This plan is implemented with the patient, and now instantly, the patient is able to participate in calibration of an eye gaze AAC device. This patient now has access to communication via this modality when the use of his body limits him from communicating in any other way. He is quickly re-diagnosed as a Rancho 5 thanks to this interdisciplinary collaboration. By the way, I've got a free gift for you over at MedSLPcollective.com/DOC. You'll get instant access to our free MedSLP Collective Disorders of Consciousness resource. Head over to MedSLPcollective.com/DOC now to get your hands on this. The link will be in the description below.